Ever get that feeling like, you hear about these medical breakthroughs all the time, almost every day, it seems like, and then nothing.
Right.
There's no magic cure appearing in your medicine cabinet.
Yeah.
It's like the science just vanishes.
It's a really common misconception. People hear groundbreaking discovery and just automatically think instant cure.
Yeah.
But there's this huge step, honestly, it's often overlooked, and it's called translational research.
Right.
It's the bridge between, a scientist shouting, "Eureka!" in the lab and you actually benefiting from it.
Okay, so less magic wand, more like low and winding road kind of thing.
Yeah.
So what makes this translational research so tricky? What's going on there?
Well, think of it like this. Like baking a cake versus building a skyscraper, right?
Okay,
so the cake recipe, your lab discovery, it might be perfect. But scaling that up to a skyscraper,
right,
that's where things get really complicated. You need different materials, expertise, safety regulations, the whole 9 yards.
And I'm guessing, with new drugs and treatments, the safety regulations for the human body are incredibly, incredibly complex.
Exactly. Predicting how a drug will behave in the body, especially when we're dealing with limited data on rare diseases, it's one of the biggest hurdles. Imagine trying to complete this giant jigsaw puzzle, but you only have a handful of pieces.
You got all these mountains of puzzle pieces, but they don't even seem to belong to the same puzzle. And isn't there also the issue of inconsistent data? That's got to play into it, right?
Oh, absolutely. It's less about a lack of data and more about a lack of standardized data. Even something honestly as simple as how doctors examine patients, that can vary, and that makes it almost impossible to compare results accurately.
So we need all our doctors speaking the same scientific language, right? Making sure the data we collect is consistent and comparable.
Yeah.
Trying to bake that cake, with grams and ounces all mixed up.
Perfect analogy. And then on top of that, you've got animal testing. It plays a critical role, don't get me wrong, but it's not a foolproof predictor of how a drug will behave in humans. Our immune systems, for example, they're just vastly different.
So a breakthrough in mice might not necessarily be a breakthrough for humankind.
Exactly.
No wonder it feels like so many promising treatments get stuck in, what's been called the valley of death of medical research.
Precisely. And this valley, it's littered with the dashed hopes of countless patients waiting for those breakthroughs to climb out and make a real-world difference.
This valley of death, man, it sounds kind of bleak. It's like, that moment in a movie where the hero's surrounded by villains and you're thinking, how are they going to get out of this one?
Yeah.
How are they going to pull this off?
Well, in the world of medicine, I'd say our hero might just be artificial intelligence.
Oh, okay.
And I'm not just talking about the AI that can write you a poem,
right,
but the kind that can analyze mountains of data and spot those aha connections
right,
that us humans, we might just miss.
So having a superpowered research assistant who can sift through all those puzzle pieces.
Exactly.
Finding the ones that fit and maybe even figuring out what the picture is supposed to be in the first place.
Exactly. Remember the case we discussed earlier, the 8-year-old girl with Shine syndrome?
Yeah.
Researchers used an AI, it was called Translator, to tackle her case.
Okay.
And they basically fed it, her symptoms, genetic information, everything they knew about her condition.
And Translator suggested, wasn't it a blood pressure medication?
Yep.
That's not a connection I would have made.
And that's honestly the beauty of AI. It doesn't think like we do. So it identified this shared molecular pathway between her rare syndrome and this specific medication.
Okay.
And get this, it worked.
Wow.
Her symptoms, they significantly improved after starting the treatment.
That's incredible. So this AI wasn't just looking for a needle in a haystack. It was figuring out that the haystack was made of something completely different.
Yeah.
But beyond these amazing individual cases, how can AI tackle this valley of death on a larger scale?
Well, one area where AI really shines is in clinical trials.
Okay.
So traditionally, these trials, they can be very slow, super expensive.
Yeah.
And finding the right participants, it's a huge challenge.
Right.
AI can analyze these vast amounts of data to identify potential candidates who are most likely to benefit from a specific treatment.
So it's not just about throwing a wider net, but about targeting the right patients.
Yes.
Making the trials more efficient and potentially getting treatments to patients faster.
Absolutely. Yeah. And AI can also analyze data from past clinical trials, even, and this is key, including those that failed, to identify patterns and learn from previous mistakes.
Right. So
this can help researchers avoid those those costly dead ends and really streamline the development process.
So AI is like learning from our mistakes.
Yeah.
Which, let's be honest, humans are pretty good at making.
We are.
But it's not all about labs and clinical trials, right? This technology has the potential to impact, like, how doctors interact with their patients every single day, right?
Oh, absolutely. You're thinking about AI in the doctor's office.
Yeah.
So imagine a world where AI is taking notes during your appointment, which frees up your doctor to actually listen and engage with you more fully. This is already being tested, and the results are actually really promising.
It sounds like AI could be the ultimate multitasker, like crunching data in the background while also helping personalize our healthcare experience.
Yeah.
But I have to imagine there are some hold your horses caveats to all this excitement. AI isn't a magic bullet, right? We've been talking about like this amazing potential of AI in medicine.
Yeah.
But I imagine it's not as simple as just like flipping a switch and letting the algorithms take over, right?
Right.
What are some of the challenges in like making this technology a reality for, for everyday patients?
Well, you're right. It's not quite plug and play.
Right.
One of the biggest hurdles is making sure that AI is actually used responsibly and ethically, especially in a field as, honestly, as critical as healthcare.
And when we're talking about AI being ethical, like, what does that actually look like? What are some of the concerns there?
So a big one is ensuring that AI doesn't actually worsen existing disparities in healthcare.
Okay.
Like, if the data used to train these AI models is skewed, for example, if it doesn't represent diverse populations, then the AI's recommendations might not be accurate or effective for everyone.
So we need to make sure these AI systems are like learning from data that represents the full spectrum of like human health, not just a narrow slice.
Exactly, yeah. We need to be super mindful of things like, underrepresentation of certain demographics in medical data.
Right.
And honestly, if we're not careful, AI could end up like perpetuating biases that already exist in healthcare rather than working to eliminate them.
And then there's like the issue of those AI hallucinations we briefly touched on earlier.
Right.
It's a catchy term, but it also sounds a bit, unnerving in a medical context.
It is. It really is. Think of it this way. Imagine an AI system is analyzing like medical images.
Okay.
Looking for signs of a specific disease.
Yeah.
If the data it learned from wasn't comprehensive, it might see patterns that aren't really there, which obviously could lead to like a false positive diagnosis.
That's a pretty stark example of like why accuracy and reliability are so paramount when it comes to AI and healthcare.
Absolutely.
Wow.
And it really highlights why this transparency is so crucial.
Okay.
We need to be able to understand how these AI models are actually reaching their conclusions, especially, of course, when those conclusions could impact someone's health.
So it's not just about like the AI spitting out an answer.
Yeah.
It's about us being able to like trace its logic, understand like why it's making certain recommendations.
Exactly. We need that clear like line of sight to ensure patient safety and to build trust in these technologies.
Yeah, absolutely.
And ultimately, I think it's important to remember that, AI is a tool, a powerful tool,
right?
But still just a tool. It's not here to like replace doctors,
right,
but to augment their expertise and to free them up to focus on what truly matters, which is patient care.
It's about finding that like synergy between like human expertise and AI's capabilities.
Exactly.
Using this technology to enhance, not replace, that crucial doctor-patient relationship.
Exactly. It's about finding that sweet spot, really, where, this cutting-edge technology meets compassionate care.
Right.
And ultimately, it leads to better health outcomes for everyone.
That's a fantastic note to end on. The future of medicine, it's being shaped right before our eyes, and it's both exciting and, a bit daunting to consider all the possibilities. So for all of you listening, if AI could design like a personalized clinical trial based on your unique health history, would you participate? Just something to think about. And that's all the time we have for today's deep dive into AI and the future of medicine. Until next time, everyone, keep asking questions and stay curious.